Good morning, everyone. My name is Felix Michael Okoje. Alongside my team members, Pem Tamang, Raju Mahajan, Suruchi Laman, we'll be discussing a case scenario of accountability and performance failure in a healthcare support worker meets refusal documentation. In the next 12 minutes, we are going to be shedding light on the context, the consequences, and the accountability breakdown. As we know, community setting depends heavily on accurate documentation and safe hands off because providers work independently without immediate supervision. Medical refusals are therefore not minor events. They require documentation and escalation to prevent harm. In this case, a failure in communication led to a preventable hyperglycemic episode. This scenario allows us to analyze accountability through a structured lens. A home care support worker visited a client who is diabetic and was scheduled for insulin injection before his breakfast. The client refused the injection because he reported to the support worker that he was feeling shaky. The support worker reassured him but did not document the refusal, nor did she escalate the refusal to the supervising nurse. She assumed that the insulin could be taken later. But later in the afternoon, a second support worker visited the client and assumed that the insulin had been administered. The client subsequently became hyperglycemic and required urgent medical attention. The family later questioned why the refusal was not flagged. This became a continuity of care breakdown rooted in accountability failure. So at this point, I'm going to be handing you over to my next team member who is going to continue on this discussion. Thank you.
Using the accountability lens, the home care worker has a professional duty to provide safe, ethical, and competent care in the client's home. Accountability means the worker must consistently follow safe medication process, ensure accurate and timely documentation, recognize and escalate any changes in the client's condition, and support continuity of care through effective communication with the healthcare team. In the home care setting, where workers often practice independently, maintaining vigilance and adhering to established care plan is especially important to protect client safety and well-being. Accountability is also relational. The worker is accountable not only for tasks performed but also to multiple stakeholders. First, they are accountable to a client by respecting dignity, promoting autonomy, and delivering person centered care. They are accountable to the supervising nurse by reporting concerns promptly and following delegated responsibilities appropriately. The worker is accountable to the employer by complying with organizational policies, standards, and documentation requirements. In addition, regulatory bodies expect the worker to practice within scope and maintain ethical conduct. Finally, the worker holds accountability to the client's family by communicating relevant updates and supporting collaborative care while maintaining confidentiality. Professional standards in home care are guided by agency policies, ethical duty of care, and regulatory requirements. These standards outline how workers should safely administer medications, document care, communicate concerns, and escalate risk when needed. Regulatory changes, such as the 2020 reforms in British Columbia, were introduced to strengthen public protection and provide transparency in professional accountability. Together, these frameworks ensure that home care providers, workers provide safe, competent, and ethical care. Evidence of performance is shown through clear documentation, handoff notes, and communication logs. These records demonstrate that care was delivered properly and that any concerns were reported in a timely manner. In this case, the absence of proper documentation and escalation records suggest a gap between expected standards and actual practice. This highlights the importance of thorough documentation and communication to ensure client safety and maintain professional accountability.
Hi, my name is Ranju Mahajan. Today I am going to present on the accountability and performance failure in home care worker. Now I will talk about the three major failures of accounting and performance failure. The first one is the documentation failure, second one is the escalation failure, and the third one is handoff failure. While talking about the first one, documentation failure, the patient's refusal, the reason for the refusal, and the exact time it happened were not recorded. In clinical practice, accurate documentation is not optional. It is a safety mechanism. When an event is not documented, it essentially didn't happen from a medical, legal, and continuity perspective. This omission closes the door on future providers understanding the contents, that limits ability to reassess the patient's needs and removes an essential trace in the chain of care. While talking about the escalation failure, when a patient refuses care or when something deviates from expected clinical activity, the supervising nurse or charge nurse must be notified. That escalation ensures oversight, second level assessment, and timely intervention if the situation requires it. Without notifying the supervising nurse, the system loses an opportunity for additional clinical judgment and potential corrective action. This is not merely a misstep, it is a gap in the safety net that exists to protect both patients and staff. And while talking about the handoff failure, no structural communication for co-workers is seen. There was no structural transfer of information such as the situation, background, assessment, and recommendation, or any other standardized framework. While talking about the poor hand of communication, it is one of the most common contributors to adverse events because it disrupts continuity when information is inconsistent or incomplete. The incoming team cannot make fully informed decisions, increasing the risks of delay or inappropriate care. According to region system model, adverse events often result from multiple small breakdowns rather than one isolated error. This case reflects both individual oversight and systematic vulnerability. While talking about the required actions and system fixes, after the minimum requirements after client's refusal should be taken. Any clients after refusal, we must document the essentials: the time, what was the refusal reason of the client, and the education we provided and who was notified. This protects continuity and ensure the next staff has the full picture. Escalations should happen within 15 to 30 minutes and immediately if there are any signs of instability. Timely escalation adds a second layer of clinical oversight and prevents deterioration from going unnoticed. To strengthen the system, two improvements are recommended. The first one is the mandatory digital promos that require refusal documentation and automatic notify the supervising nurse. And the second one is an end of visit safety checklist to confirm escalation and ensures a proper handoff. Finally, psychological safety is essential. Staff must feel safe to speak up, report concerns, and escalate issues. When people feel blame, they stay silent, and that silence is a major contribution to preventable harm.
Leadership, reflection, and accountability brief. From a leadership perspective, this case highlights the need for an accountability culture rather than a blame culture. The leads framework emphasizes achieving result and engaging others. A leader need to know whether their team are working together, they are feeling involved and responsible. A leader need to create a safe environment, psychological safety for their employee, where they can speak up about their mistake, they can ask new questions, share new ideas, and provide constructive feedback. While servant leadership prioritizes patient safety and ethical responsibility. For an example, Israeli 2012 argues that accountability discussion often remains symbolic unless it is supported by enforcement, transparency, and performance evaluation. In this case, documentation policy existed, but reinforcement and monitoring failed. Leaders must create systems that support reporting, clarify escalation pathway, and reinforce professional standards. Accountability is not only an individual job or responsibility, it is also about designing a safer system. The case demonstrates how directly leadership influences patient safety and outcomes. And in conclusion, this case shows that accountability is essential for ensuring continuity and safety in patient care. When documentation and communication are missed, it creates gaps that can directly affect patient outcome. In this case, failure to document and report the insulin's refusal led to preventable harm and showed gap. Clear process, proper communication, and performance monitoring help ensure that every team member contributes to safe and effective care. As a future leader and healthcare professional, it is our responsibility to support strong system, follow standard, and promote a culture where patient safety is always the first priority. Moreover, this case also shows us importance of interpersonal collaboration, role of continuous education and quality improvement, patients and family involvement in case, creating a supportive environment, non-punitive culture where concern can be raised without a fear of punishment, which will also help strengthening patient safety. And in the next slide, we have references. Thank you.